I think we all would like for the panel to talk to many moms, children, adolescents, parents, and individuals with sickle cell disease to reach out to the very experienced and august panel to get their feedback. So this is an open mic session, and we'll go into the last question has been answered, or the panelists cry uncle and say no mas.
Mm-hmm.
I'm not.
So I see a few questions in the Q&A. So
okay. Why don't we jump in? And if we hit a stall, I'm going to ask Carla a question. So why don't we jump in and hear from our audience? You want to read it out, Kristen?
I see a question that says, what do you all feel your family or loved ones could do more or less to help you pre-post through this process?
I think the biggest thing is support. I think you need it at the beginning, need it at the end. That was one thing that was key for me going through this process was I had support of my mom, my wife, my surrounding family, my extended family, because we don't always think about the other people that are around us, that are looking out for us, that are taking notice of things. They may not say anything, they may not even be there at the time, but they do provide a level of support. One big thing that helped me was my stepmom. She came out during my transplant, after my transplant, when I was being released from the hospital, and she stayed with me because I had to stay in Maryland 120 days after my transplant. And you know what? There's nothing like having somebody that has your back, that's there with you. My wife couldn't come because she had my daughters. My mom couldn't come because she had work. So my stepmom came. So if nothing else, if they can do nothing else, as long as they can support you from the beginning to the end, that's what you're going to need.
And I also just wanted to add to that. I do think support can seem so overwhelming sometimes to family, because it's like we know what you're going through, but we don't really know what you're going through. And sometimes it kind of gives a dynamic of walking on eggshells around talking about everything that you're going through. So for me personally, I just wanted to highlight something as little as just sending a text, hey, how you doing? Because when you're going through the transplant, you're isolated, you are you're processing a lot mentally. So I'm usually the strong friend that is checking up on everyone. So being able to reclude back into just my, I can't pour into you guys right now. So just having them being able to take the initiative to recognize that and take the initiative and proactively reach out, I think is important.
I think for me, support was having my family and friends giving me some grace and trying to figure out this new normal. I have a new identity. I'm trying to figure out how I identify now, like how am I going to navigate this life post sickle cell? What is, being cured? So for me, support was definitely giving me grace and being able to do that.
I would say for me, it had to do with, patience and love. And I say that because there are times during the trial itself, when I was administered the chemo, I broke down a couple of times. And, a pat on the back from not only the support team, but my wife helped me a long way. So, through those hard times, continue with the love, continue with, the patience. We're just trying to get better. Yeah. No, that's all I have to say.
Kristen, you want to jump in with another question? I just want to keep the questions going so we get the feedback from the people waiting so patiently.
So I've had the luxury of actually getting to talk to all of our panelists one-on-one. And so one of the things though that always comes up is, we use the phrase curative therapy, right? But what is cure? And what does that mean to a person pursuing those therapies?
To me, cure means just not experiencing those excruciating pain crises for me personally, because I did have slight pain on and off, but as far as my pain crises, like Carla mentioned, it was always like 8 out of 10, 4 o'clock in the morning. That's how my sickle cell like to bond with me. So I just not having to experience those excruciating pain crises that's waking me up in the middle of the night, not having to take off of work, take leave of absences from work because I have to get my hip replaced, and just even the small things, being able to go to the gym and do cardio without going to the ER later on because I've now triggered a crisis. Um, all of those aspects of the way that I live now, that is what I define cure for me, because it really is a complete 180. And I'm just super grateful that the lifestyle that I live now, it's way better than when it was when I was living with sickle cell disease.
It really depends on the person for themselves and what they've dealt with and what they've experienced. I mean, for me, it was not planning a trip or planning anything, because every time we plan something, I would get sick. So, I mean, I don't think I'm the only one in that bucket. I think there's a lot of people that are in the bucket with me. So that's part of it. I mean, the cure, you want to get past some of the things that are going to hinder your life as much as possible so that you can focus on the things that you want to move forward with.
You had curative therapy at an older, like an older age, right? And so there's a question that says, do you wish you had pursued curative therapy earlier?
It wasn't at the time that I ended up doing my transplant, what I had seen as far as therapies for people with sickle cell, the negative outweighed the positives. So so to say, as when I was younger, transplant was not as successful with people with sickle cell. So that was not something that I looked into or I did more with, because my wife is a nurse. And so she saw a lot of the same information I was seeing. And she read a lot more than I read. So at that point, I was not looking to do a transplant. But as I got older and things went down the way they went down, there was an opportunity. And it wasn't, I didn't look for it. My wife didn't look for it. Another person that knew my wife and knew me had saw some stuff that made her need to bring to my wife. And she brought to my wife for about 7 months. And my wife said, okay, let me look at this because this person keeps talking about this. So there must be something here that I need to look at. There must be a change or a shift in what they're doing that's making this more successful. And that's kind of how I got on this train.
I would say that this is a very hard question to answer, because in some ways I wish I had done it younger, because maybe my body wouldn't have gone through as much damage as it did with sickle cell disease. But when I really think about the mental health aspect of things, I think I had it at the perfect age. I think it's taken a lot of strength and unlearning of old habits and coping mechanisms to navigate my life without sickle cell disease. And so if I had done it at a younger age, I don't know if I would have had the wherewithal or intelligence level or emotional intelligence to be able to realistically tackle what life has thrown my way post-clinical trial. And so I think, but I have seen younger patients where their bounce back rate is so quick. And by that time, they haven't dealt with avascular necrosis or have an organ failure where they have to have their, like a splenectomy. They haven't gone through as many advanced complications of sickle cell disease. And so they're able to kind of recover very quickly. Whereas for me, realistically speaking, I didn't feel like fully cured until maybe a year post-transplant. Yeah.
So, Carla, you were going to say something?
Yes,
You want to
I
go
will
ahead and-
say, I will say this. One of the decisions that my son concentrated on is when they told him that due to his age, as he gets older, having a bone marrow transplant, considering it years after, he may have more complications. And his age, considered now that he's, closer and younger in his teens, was a best option. So I would definitely say that science has also come a long way. And like I said before, when he was 12, that conversation also arose with his doctor, but by his bedside, and even myself, was an active mom. I'm a, you know, an advocate. So I connected with experts. I knew the sciences. I knew the conversations that was having behind doors with unsuccessful transplants. So we always have to remember where we're at in this time. Also, science have come a long way. And so when we can look now at data, being able to support success, knowing that there is a chance that, yes, it may not be, you may be one of the unsuccessful, but you may be one of the success stories. And that makes us proud that science have come a long way. So I have to say that this is a great time in science, and to be a part of this conversation means a lot to me. And I hope that we continue to see more feedback and conversations like this, as it's a hard decision to make, but it's being made because of conversations like this.
Carla, you summed it up very nicely. I really appreciate it. I want to underline this point, and then I'm going to ask the panel a question as I underline this point. This is not often discussed, but I can't overemphasize the point that it's still early days, okay? And all of the experts that talk today, starting off with Dr. Shea, and then ending with Dr. Shenoy, will tell you that their belief is that in 2033, the curative therapy results will be better than in 2023. Not just a little bit better, but a lot better. So as we, and this is the type of discussion that needs to be had at the bedside or in the office with the family. Is there an urgency for now? And I think you heard this spectrum from the panelists. Said, look, I'm ready to go now. I don't have another decade. And then others, as you heard Carla say, we were willing to put this off at 12. We were willing to wait till the science evolved because the risk-benefit ratio was not favorable for my child. That is a very nuanced decision-making. And what we are pushing for as hematologists in this field is that you all get the full disclosure. That if you go to place A in Nashville, you don't get offered one type of curative therapy with the idea that this is the greatest thing that ever happened, like CRISPR therapy, which has only been done in less than 40 patients. And said, wait a minute, talk to me when you get to 400 or 150 or 100, okay? Particularly for children, where we now know that the life expectancy for a child with sickle cell disease to 18 is 98, 99%. We can't say that about curative therapy with sickle cell disease. So this is very complex. So I just wanted to overemphasize this point to the extent that as you all are advocates and really beacons of light for families, that you're able to explain this nuanced component, that we're going to be better in 2033 than we are in 2023. So if there's no urgency on your part and there's no morbidity that says that you have a shortened lifespan, then you may be better off waiting. But for those who want the urgency to be an early adapter for new therapies, we're here to provide it. We just want the disclosure. So the question for the panel, you all have done such a great job, and I have to give my hats off to all of you. In some ways, you have provided a formal guide of what individuals with sickle cell disease should ask for when they go to their provider. I mean, Carla listed all these things. How many transplants have you done? What's the results? What are the other options? How good are you? Who are your competitors? Okay, I mean, she hit it all, okay? This is what we want you all to, we feel better when you come well-informed. Because when you come and say, I just want to be cured, and you don't understand this nuance that we just described, then the burden becomes, you start trusting us, and we want you to trust yourself. So with your permission, we'd like to put this together in some type of write-up that will be written in the layman's term. What are the essential questions that an individual with sickle cell disease or parents with sickle cell disease, of a child with sickle cell disease, should ask of their provider? We don't want you to go through door A when there was 4 other doors that you could have gone through, and it's just because of location that you went through that door for curative therapy, and there are other options less than an hour away that's better suited for you with a better track record. So if I see you shaking heads, we'll put something together. We have this as a transcript, but we want to put this out for other families to do this. And we'd love to have you back next year to be more informative, ask you more questions, because, you know, we could be here for another 2 hours and still have a bevy of conversations. So I really appreciate all your time, effort. This has been vibrant. Like I say, we look forward to this session every year to better help our families. So with that, I will end. And any last housekeeping?
There was one question that was out there that was talking about sickle cell SC. And although SS gets more people talking about, I think SC is just as important. I think the way you have more bone issues, more issues with your shoulders, your hips, the rest of you is important, and it matters. Just like it matters with SS. SS, you have more blood issues, but SC has more bone issues. And I think that no one should say, hey, well, that's less of an issue. No, because those are big things too. If you have hip surgery, you definitely aren't walking. I mean, if you have a shoulder surgery, you're definitely not writing. So I don't think that you can technically quantify or compare the two, because it depends on the person and what their disease progress is.
So Chris, you'll be happy to know that most national experts agree with you. And so severe sickle cell disease is severe sickle cell disease, not severe hemoglobin SS or hemoglobin SC. So there's, you know, for the well-informed, for national protocols, there's no argument here, okay? So if you get argument about SC not being as bad, particularly for the adults, then, you know, frankly, without buttering it up, you're dealing with a poorly informed provider.
Taylor, do you want to say something? Go ahead. You're muted.
Yes. So I wanted to also emphasize the importance of doing your research before you just jump into curative measures. I'm not a doctor, so even though, you know, none of us sickle cell patients here are doctors, so when we're sharing our story, we're just doing it so people can see what options there are out there. But at the end of the day, I think everybody should do their own research and really look into, you know, the cures and what you're getting, so that way you know the process behind it. And that's just what I want to, you know, strive home with everybody, is make sure you do your research. Don't just take somebody else's word for it, because this could literally be a huge thing in your life that's like turning a new corner. And especially with all the side effects and possible things that could happen, it's just best that you know all the outcomes, possible outcomes, risks, everything, so you can make an informed decision for your health based off of, you know, how you feel about the situation.
Thank you.
I was just going to say that I think it's important to talk to peers that has had the transplant and has been through this process, just to get a better understanding. So Be the Match actually has a program called the Peer Connect program, where they connect you with someone with sickle cell or whatever disease that you're getting the transplant for, and they connect you with that peer, and they kind of follow you through your process during the transplant process and post, just kind of like help you out and guide you through that journey.
Thank you. So I've talked to several people about the gene therapy protocol, the curative treatment, and several people that I talk to sometimes believe that, you know, when we go into these trials, that we're going to be treated like lab mice, and we're just going to be tested on, and, you know, they prefer not to go through. I'm here to say that it's not that way. NIH was a huge support system as well as my family. But they were very transparent in everything they did. I always had the option to end. So if you're a sickle cell patient out there wanting to, you know, thinking about going through the trial, understand that you have the total option to just, you know, stop it, and everything is transparent, and you will have a good support system dealing with, you know, the medical providers. And, you know, we hope, but I wasn't treated like a lab mice. So
yeah, I just want to say, you're dealing with one of the top programs in the world for clinical research in the world. And I can honestly tell you that not every transplant center has that level of support and reputation. And the financial toxicity is not part of the equation at the NIH because all the care is free. The travel is free. There are children and adults who go to transplant centers within the vicinity that after their year of curative therapy, because the insurance company usually pays for 1 year, they revert back to their old insurance and they scramble to find a provider who will provide the medical care after the first year. So again, this goes back to Carla's point. You're like, do your homework. And our challenge is we need to provide you with a cheat sheet, right? Like, here are the questions that you need to ask, particularly if you're traveling, you live in one area and you're traveling to another area for the care. Who's going to be responsible for the care when you come back to that area? Who's going to be responsible for the care when your insurance goes to perhaps Medicaid, which is about 60-70% of the children and adults? Okay, so again, we just opened up a whole nother bag of worms, and we're 3 minutes before the 2-hour mark. Okay, we got some other last comments before we sign off the mic.
Well, while people are signing off, one of the things that stands out is how much this is a process, right? You don't get struck by lightning one day usually, and then everything is clear. There's a process behind the lightning strike. And Project Spirit is working is a sickle cell focused organization supporting the spiritual and mental welfare of our community. And they are hosting some events for people who are interested in curative therapies. And the information to register is in the chat. If you're interested in meeting with others who are considering this and talking things through.
Okay. Thank you so much. We will plan on doing this again in the fall. Please send us ideas for this wonderful panel and experts you want to hear about, challenges you want to hear about, so that we can spend the time putting this together for you all, okay? We depend on your input to do this better every year, and we look forward to our interaction next fall.